Local Memphis Live continues with your host, Amy Sparopoulos.
Welcome back to Local Memphis Live. Our next guest is a woman on a mission, working to make strides when it comes to closing the gap in breast cancer between black and white women. Just named as the Mobile Disparity Coordinator for Baptist Breast Health Care Program. Welcome, Venecia Harris. Good morning to you. And this is her television debut.
Yes, it is.
Thank you so much for starting with Local Memphis Live. And this position really is crucial, and it could ultimately save lives. Tell us about that.
Yes, that's right. It's a part of the comprehensive breast program at Baptist Women's Health Center. It is a grant-funded position by Avon Foundation, and we have several grants in place. However, this is the first position of its kind.
Talk about, if you will, why there is the disparity between black women and white women when it comes to getting mammographies and things like that.
First of all, our city has very high poverty rates, and you know, with that, with poor women, they lack insurance, they lack resources and ways to get the health care that they need. So Baptist has always been very involved in providing access to care. We've had a mobile unit in place for almost 30 years now, and it goes out across the city, and I will be targeting those communities which need it most, underserved and underinsured communities.
So this has been a long time coming, so to speak, and they've researched and they know which communities to go to. And tell me too, it is about education and awareness as well?
Yes, that's correct. I'll be doing a lot of health fairs and community outreach, speaking where there is churches, wherever there's needed, just to get that word out, because the early detection is the best prevention against this cause.
And people at home too can help really by just encouraging their neighbors to get a mammogram.
And their family members. It is very important that you do that. If you're not 35, it's important that you do your self-checks every month. However, if you're over the age of 35, you should get your yearly mammogram done at the time of your annual physical.
Very good. And what should women do to get that grant-funded mammogram?
There is an application process. It's very quick, and I will be contacting everyone which is eligible.
Okay.
You'll dial 226-0830, and they should have that number to submit an application.
Wonderful.
Yes.
Takeaway for folks at home?
Yes.
All right, and just be knowledgeable, as you mentioned, do those self-checks. And I think we had, a few years ago, I know the breast cancer foundations out there said, maybe called it the buddy check. Call your neighbor, your sister, things like that.
Yes, a while ago there was a huge Sister Pad campaign.
Yes.
I think that's what you're referring to.
Yes.
And that you will see that around a lot coming up real soon. However, we are partnered with a lot of local organizations and women organizations to partner together, because we share resources, we share information, and we share research. So we're all after the common goal.
Yeah. All right. Thank you so much. We sure do appreciate it. Stay with us. We're back after the break.